Can I do pelvic floor therapy on myself? Well, I honestly don't see why not. But do you know what you're doing? I'm not talking about using your index finger to try to go inside through the anus or vagina or both and try to access this area. The part of pelvic floor therapy that I'm referring to is the part that has to do with the stability of your pelvis. Pelvic floor is the floor of a house called pelvis, and it does not get compromised in majority of cases, with the exception of trauma, which trauma is not childbirth. Trauma is a compromised stability in the pelvis that when childbirth happens, as an example, it complicates it. And frankly, there are plenty of people who've never gotten pregnant or given birth, and frankly, not of the right gender to give birth. So what's the excuse there? So if we work on stability of the pelvis and understand what it takes to stabilize it, then your job as the owner of the body is to maintain and provide those tools necessary to maintain what you have created. So in my practice, for example, I consider a treatment plan successful when my patients, the owner of the body, sees the mistakes and that they're about to make, or they can foresee what their action is going to impact. They can prevent by seeing all of that, so they bring in the principles of movement which allow the pelvis to stay stabilized. So my goal is to make sure that my patients are understanding the principles of movement. They understand how there are certain things that are non-negotiables, and they live their day evaluating those all the time. So your lifestyle and your ergonomics are so important and play a big role in the stability of your pelvis. When it comes to your pelvis is the base of your trunk. Your trunk is the part of your body that your one-piece bathing suit covers. So if your one-piece bathing suit has no straps, but it's sleeveless up on the top and covers your body, the part that is covered is your trunk. Pelvis is the foundation to your trunk. Therefore, your trunk's positioning plays a direct role right here. It plays a direct role on what's happening on the structure above. Additionally, your legs are connected to your pelvis, and the positioning or lack of performance or dysfunction in their movement start impacting the pelvis. Does it get yanked and pulled and pushed, tilted down, tilted up, all of those? When you're working out, are you using those the right muscles? I'm not asking you to become a doctor. I'm asking you to understand your body. Take the time to understand your body, just as you take the time to understand the different features of your computer and your phone. There are certain things you cannot avoid, and there are certain prices to pay when you avoid them. When you're driving a car, you have already shown that you know the principles of movement, and you've exhibited the ability to drive the car. Do you know what the principles of movement are for your car called your body? Chances are you don't. In fact, I'm going to take the bet that you don't. If you're watching this, most likely you don't have a clue what they are. There are principles of movements that we need to know because we're using this body. Those principles are what we have learned by studying babies, because all babies on this planet move the same way. They go from a helpless infant to a running toddler without being coached or trained, without going to the gym or lifting any weight. We're all programmed to follow that. So the correction of a problem is going back to the basic. The principles of movements are identified by studying babies, watching them go through the process. So when it comes to pelvic floor treatment, you gotta understand it, and then of course you will be doing that to take control of your pelvic health and frankly your whole body's functional health. I am a living proof of someone that experienced an injury. I fell off my horse and I actually shattered my hip socket and more. I'm a living proof of someone with pelvic floor dysfunction that is continuously working on not allowing that become the reason why I decline. So I hope these things make sense. I hope you look into what that entails, and I can assure you it does not start with strengthening exercises. To strengthen anything, you need to have the mechanics down. When you don't have the mechanics down and you start stretching a muscle or strengthening a muscle, you're not doing yourself a favor. You're simply over strengthening, over emphasizing the dysfunction more than anything else. If you have subscribed to my channel, thank you. If you haven't, this is an opportunity to do so. If any of this makes sense, I hope you look into it, and please use one of the methods of contact in my description box to contact the office. I'd love to go over this with you in person. Thanks for watching.